Good afternoon. I'm George Latimer, Westchester County Executive, and I'm here today with other representatives of Westchester County government to provide some recognition for a number of nurses from the New Rochelle School District that saved a life. They showed their skill set on display and heroic actions, and a teen's life, which might have been lost last week, was saved. And we want to thank those individuals. We're here to recognize them. I'm joined by some of my colleagues in Westchester County government. Our county clerk, Tim Idoni, is with us here, a New Rochelle resident, former mayor of New Rochelle. We have two of the county legislators that represent New Rochelle. Terry Clements is here, and Damon Marr, and also David Tubiolo, who's a county legislator representing Yonkers and Mount Vernon. We have a number of our executives from different departments with us here, and of course we're going to be hearing from Dr. Charlita Amler, who's our Commissioner of Health, as part of this, but we're appreciative for our Deputy Commissioner of Mental Health, Joe Glazer's with us here, Bill White's from that department, and others as well. So our purpose here really is an appreciative one, which doesn't always happen in government. Many times the dialogue about government is negative. It focuses in that direction. And when something positive happens, we treat it as something that's either not that important, or we look for the negative side of something that's positive. But in this particular case, last week, a New Rochelle high school student nearly overdosed from vaping a substance. I believe she believed it was marijuana, and whatever the circumstances were, she was unconscious. New Rochelle school nurses who are here with us today, they're trained to spot and treat potential overdoses, and importantly, they have Narcan available on hand at the school. They were able to use their skills and the Narcan to revive the individual, and she's still with us today, and we're very appreciative of that. There's very few people that can claim credit for saving a life. These individuals jointly and collectively have done that, and that is a real impressive thing, and that's why we're here today to recognize them. For the purposes of any of us who are not particularly medical professionals, we've mentioned that Narcan was available and Narcan was used with this individual. Narcan is a nasal spray that, when used quickly and effectively, can reverse an opioid overdose and restore breathing that might have been dangerously slowed down by a drug or prescription painkiller. And I believe Dr. Allen is going to talk more about that from her professional experience. Because of the swift action of these nurses, that teen is alive today. We're appreciative of their action and deserving of their praise. It's also important to note that in our school districts, our communities, our residents, and our families, Westchester County's Health Department offers free Narcan training at no cost. And this is something where medical professionals will have the skill to do this, but average individuals will also know how to use this. And so if the circumstances arise and they have the access to Narcan, that they too can be involved in saving a life. The training can be taken by anyone age 18 or over, lives or works in Westchester County. Narcan is provided for free for anyone who completes the training. The Health Department provides school training as well as community training, and the residents who participate will receive a free Narcan kit. You'll be able to visit our Health Department website to get more information. Some of that information is going to be shared in a second now by our next speaker. I'm joined first by Dr. Charlita Amler, who's our Westchester County Health Commissioner. She and I have gotten to know each other very well because of this little thing called COVID that we've been dealing with. But the Health Department deals with a wide range of activities. They provide sanitarians that go in to check the health conditions of restaurants. They provide response, as we've seen, for communicable diseases. They give us education on a wide range of things that could affect our health. And Dr. Amler, who is serving now for her second administration, has done an exemplary job, and we're very proud to have her here. Dr. Amler?
Thank you. So I think we should all be grateful that these 5 nurses quickly recognized the signs of an opioid overdose and responded appropriately by administering Narcan to save a student's life. It's an unfortunate reality that opioids and those laced with fentanyl are a threat to our community and to our children. Fentanyl is a very powerful synthetic opioid. It's actually 100 times more potent than morphine. It's cheap and easy to manufacture, and so it is often added to heroin to boost profits. We recognized the dangers of these substances more than 8 years ago when the Westchester County Health Department began training first responders. We actually started with police officers to administer Narcan. To increase the potential to save lives, we've expanded our training program every year, and with the support of County Executive George Latimer, we continue to do so. We have shared Narcan training with more than 6,550 nurses, pharmacists, medical, dental, and nursing students, community leaders, educators, family members, substance abuse counselors, healthcare professionals, and just the general public. And today, we see, once again, that this training really works. I think the beauty of Narcan is that you don't have to know for certain that it's an overdose. You don't have to know for certain what drug is involved. You just have to have a concern that this person, for whatever reason, is having an overdose, and maybe they're not breathing so well, and maybe they're unconscious. And you can give Narcan, and you can give it safely, even if they aren't overdosing on an opioid. This is a very, very safe drug. When I was a very young pediatrician many years ago, we used to give it to babies after they were delivered whose mothers had received narcotics during the delivery. When they weren't breathing very well, this drug would perk them up and they would improve very quickly. So, and with no side effects, a very, very safe drug. And as I said, you don't have to know what drug you're dealing with. If it's not an opioid, it simply won't do anything. It won't work. If it is an opioid and the person is overdosing from an opioid-related drug, and it could be a mixture of many drugs, but if there's enough opioid in it that it's reducing the respiratory rate of that person and you give them this drug, it's going to improve their respiratory rate. And if enough of it is an opioid, in a minute or two, they're going to open their eyes, sit up, and wonder what was even happening to them. So you can go from literally dead, no heartbeat, no respirations, to sitting up and talking in a matter of minutes. I've seen this work, and I tell you, it's really, when it works, when it happens and it works, it's nothing short of a miracle. Narcan is the brand name for naloxone, a life-saving drug that can reverse the overdose in the body, and it lasts for about 30 to 90 minutes. Unfortunately, sometimes the drugs can last longer in the body than the Narcan, so it's very important if somebody is in an opioid overdose situation, once you give the Narcan and they are revived, they should seek medical care just to ensure that the drug Narcan doesn't wear off before the opioid does. The nasal spray Narcan works in a minute or two. This emergency response allows time for transport for the person to be transported to a hospital. Deaths from opioid overdoses, I'm happy to say, have decreased since we started this training, according to the New York State statistics, but the threat does continue. Narcan is a tool that gives the substance user a chance to seek counseling and treatment and to manage their substance abuse disorder. I tell that to the police officers and everyone that we train. This gives somebody an opportunity at a second chance. Instead of being dead, they have an opportunity to seek care for their addiction. I want to encourage everyone to learn how to save lives by administering Narcan. Anyone can do this. You don't have to be a nurse or a doctor. And you can just visit our website at health.westchestergov.com/Narcan and sign up for a training. The training is free, the Narcan is free, and we're happy to give you this tool. Thank you.
Thank you very much. That's Dr. Charlene Amler, who is our Commissioner of Health. Next, we're going to hear from Dr. Brooke Balchan, who's the Medical Director and School Physician for the City School District of New Rochelle. And we appreciate, Doctor, your presence here and the story that you'd like to share.
Good afternoon. Thank you, County Executive Latimer and Health Commissioner Dr. Amler, for bringing us here today to recognize our New Rochelle nursing staff for saving a student's life with our opioid overdose prevention program. The City School District of New Rochelle has been a New York State registered opioid overdose prevention program since 2016. But prior to last Monday, Narcan, a life-saving nasal spray we just heard about, that we've had stocked in all our buildings, has never been used. We were so incredibly lucky that our school nurses were able to identify and intervene for a student who displayed symptoms of an opioid overdose. Without this program and our heroic medical staff, the outcome for this team could have been so much grimmer. We want this to be a wake-up call to everyone. Taking street drugs of any kind comes with an inherent risk of an opioid or fentanyl exposure, even if it looks like a pill, powder, or vape that you've tried before without any consequences. We learned fentanyl is a synthetic opioid that's up to 100 times more potent than heroin. It is highly addictive, and it has been labeled by the by the DEA as the single deadliest drug threat our nation has ever encountered. It is not a coincidence that our nation's youth mental health crisis is overlapping with the rise in opioid and fentanyl-related deaths in teens. Substance use and mental health are co-occurring disorders. It is more important than ever to have open dialogues with your families about mental health, safe coping skills, positive peer relationships, and the real risk of overdose from fentanyl. Narcan is available through the health department and through pharmacies without a prescription. And any district that is yet to implement the opioid overdose prevention program should make it a top priority to train staff and keep Narcan in all of their schools. Your health matters, mental, emotional, and physical. In case you need help for yourself or someone else, I also want to drive home that there are 3 numbers to keep at hand. If you need access to emergency medical care, call 911. If there's something that you just need to talk about regarding your own mental health or substance use, you can reach 988, which is the National Suicide and Crisis Lifeline 24/7, by calling or texting 988. This number was changed from a 10-digit number over the summer, and it's available for anyone. Or through our county partners, reach the County Crisis Prevention Response Team with 914-925-5959 if you're a family member or community member that needs help referring somebody that needs assistance. We are all in this together, and thank you again.
Thank you very much, Dr. Brooke Balshan, who is Medical Director and School Physician for the School District of New Rochelle. Now we have each of our nurses who are going to receive a proclamation from the county, symbolic, something to put on the wall. We don't do this very often, but this will recognize each of you and show our appreciation. And I think, and I'll defer to my communications team, I think what I'll ask the nurses to do is each stand in front here as they receive the proclamation, and then when we have picture taking, whether it's the general media or other cameras, I will ask county legislators and Tim Idoni, county clerk, to stand on either side of them, and of course Dr. Amler. And so whatever pictures we have to get taken, we'll do the pictures that way. If there's any questions about that, we'll just work through it. First of all, we have recognition for Dr. Balshan for her outstanding work in her responsibilities and the overall leadership in this department. Thank you, Dr. Balshan. Now let's make sure I don't butcher these names one at a time. Diane Vetrano.
Great.
Diane? Congratulations. Stand around and face everybody else. Get nice and nervous that way. Next, Wendy Michelli, or Michelli. Michelli. Next we have Lisa Grillo. Lisa. And Kamora Camo. Kamora. Thank you. These are young ladies who have saved a life and done us proud for their service. And just before we begin all the picture taking, I think any of us who are here, the folks who are here in the media, those of us who are here in a governmental capacity, we understand there's a lot of things you can do for a living, a job. There are jobs that over some period of time turn into careers for individuals, but there are very few careers that are really callings, and it takes a very special person to determine that they want to do a certain thing for their life's work that involves them putting themselves out front and center. We've seen what nurses in general have done during the context of this pandemic. And just like police officers, firefighters, individuals in so many of these different areas, they are first responders. And this is literally an example of a first response that became a definitive response. So, ladies, thank you very much for the service that you've given all of us. Let us give them another round of applause, and then we'll get a picture taken.